May, as we know, is Mental Health Awareness Month. Why is it important to acknowledge, to start talking about it, and to have this as a month? Why is that important?
Well, it's something that it brings awareness, number one, that there is an issue. And it helps people to realize that, wow, if it's on the calendar as a month, it's okay for me to talk up and say that there's something going on with me. And it may be something as little as, as anxiety. Well, I'm just anxious about something. Well, in our culture, a lot of times people say, well, just take a deep breath and you'll be over that. But they don't understand that there's this mental health piece of it. One thing that really is scary to me is I'm seeing a lot of youth that are talking about mental health issues, and we're not really talking about it, but what they're doing is they're acting out, and the parents are like, well, what's going on? And sometimes it's a reflection of that parent. If the parents have anxiety, the children are picking up on it too. And then a lot of times our kids don't have the language to describe what's going on. So it's something we have to be talking with our kids about. Yes, this is a scary time. Yes, we can get through this. But we want to talk about how you're feeling. We want to talk about what's going on in your body, where you're feeling uncomfortable, and allowing them to talk, because a lot of times we're not giving our kids that opportunity to talk.
Michelle, given the stigma, especially in the faith community, about mental health issues, if people are feeling anxious, if people are feeling depressed, a lot of people are still working from home. A lot of businesses are still having people work from home, and just being out of that normal routine creates this anxiety. But given that there's a stigma, what should we do to encourage people to begin to open up and to get the help that they need?
Yeah, one of the things when I'm training, one of the things I say to people is, so what are the joys that you've had this week? Because we always want to start out on that positive note, right? And then I say, what's the struggles been this week? And, we have to be willing to sit down and look at people in the eye and listen to them and hear with them. We have to see them as people. Jesus spent time sitting with people, talking with them, and we need to do the same thing. I said to somebody, sometimes we do we're walking by. Hi, how are you? Oh, I'm good, I'm fine. And we just walk by. We never even stop and look at them, right? I tell people all the time, say, hey, today's a difficult day. And I go, I will guarantee you'll get the, hey, good, I'm glad to hear that. And they keep walking, because it doesn't sink in. It doesn't sink in. We don't stop. But we need to stop and look at people. And like you said, we need to do things. We need to connect. When COVID first happened, what did people start doing? They start running through their phones and they started texting people, hey, haven't heard from you in a long time. And we connected with people. There's so many times as faith people, Christians, who are struggling. And sometimes, at night you can't sleep, right? Well, for me, I tell people, if you can't sleep, Lord's put it on your heart to be praying for somebody. And you just start praying. And when you prayed for the person the Lord wants you to pray for, you'll fall asleep.
Just like that. That is so true.
Just like that. But you can be awake. You can be awake for an hour and a half praying for people, person after person after person. And then all of a sudden you pray for, hey, somebody who's just on your mind. But if the Holy Spirit puts somebody on your mind, reach out to them.
It's for a reason. It is for a reason.
Exactly.
You're going through something that no one knows about, but God knows, and He's putting it in your heart.
Exactly. Sometimes I have people. I connect with people all the time, and I'm like, well, how you doing? Well, the typical answer is fine, and I'll say, well, really, what's going on? Because, oh yeah, fine. If we take fine as acceptable, tell me what's going on. Tell me those struggles. And then people will share, but we have to be available.
Be sensitive and available.